Hi, everybody, and welcome back to the gastrointestinal physiology. If you remember, we were talking about the physiology of of the gastrointestinal system, and I told you that gastrointestinal system is not just limited to the absorption and digestion. Absorption and digestion need some preliminary step to be done correctly, and also the regulatory mechanism to be correctly done in order to allow the absorption and digestion to happen. Therefore, in the first sessions that I told you about the function of the nerve of the gastrointestinal system, I told you that there are several other functions such as motility, secretion, regulatory mechanism, and also the process of absorption and digestion, and the regulation of the homeostasis of the body by the gastrointestinal system. From now, I'm going to start new topic about the motility of the gastrointestinal system. In other sections, I will discuss the secretory function of the gastrointestinal system, and finally, we will reach the final function of the GI system that we know as absorption and digestion. When we are talking about the motility, we should know that in the GI system we have two type of motility. That these two type of motility are general, and it is not just limited to some part of the GI system. It could be seen in the esophagus, in the small intestine, in large intestine, but with some differences. But this is a general movement, and one of these general movement is named as peristaltis. Peristaltis means the wave movement that push the bolus of food forward. And as you see in this schematic figure, in each step, one bolus of food that we are ingested move one step forward. For example, as you see in the step one, the food is here, and the contact of the food bolus to the wall structure of the esophagus or a stomach or in the small intestine. Particularly, we are talking about the small intestine and esophagus and the peristaltis that we see in there in these tubes. The contact of the food with the wall structure will initiate a contraction, ring contraction, just behind the food, and therefore here we have the pressure that is increased. Then when this pressure is increased in this area, then the relaxation of the smooth muscle in the front line of the food will be happening. Therefore, we have a pressure gradient between the distal part and proximal part, and from mouth toward the anus there is a pressure gradient that push the food forward. On the other hand, the next step is the contraction of the longitudinal muscle that make this segment a little shorter. Therefore, not only we have a contraction, ring contraction that increase the pressure, but also we have a longitudinal muscle that make the vessel a little, make the tube a little shorter. Therefore, move the food one step forward, and then food will be contacted, will contact with the another segment, and another wave will start, and this wave movement will move forward to send the food to the destination. This is named as peristaltis, and you know that this is the basic movement that we have in the gastrointestinal system. Another type of movement that is seen in the intestines, particularly large intestine, is named as segmentation. There are several modes of segmentation movement, But this segmentation have less function with the movement of food. They are mainly involved in the mixing of food with each other. Have a look at this figure. As you see, I'm showing you this figure in different colors. Imagine we have a food content in the intestine, particularly large intestine, and these simultaneous contraction that is happening in different areas of the intestine push the food in two directions. One's part of the food back and one forward, and from another segment and contraction again this is happening. Therefore, in each segment the food will be mixed together. Then another segmentation will happen in another space. Firstly, this contraction happen in this space, but then next segmentation happen in this segment, and this make the mixing the food completely possible. This is named as segmentation, and this is also another general movement that we have. I will show you that there are several type of segmentation contractions. Some are isolated, some are regularly spaced, some are irregularly spaced, some are very strong, some are a little weaker. These are different type of segmentation that we have in the gastrointestinal system. Now, when we want to discuss about the gastrointestinal motility, we should start. Let's start with the mouth and the movement that we have in the mouth, and then esophagus, and then stomach, and then the intestine. The first movement that we have in the gastrointestinal system, as I told you, is in the mouth, and this part is not a function of a smooth muscle. It is a voluntary movement. Therefore, this part and this movement that I'm going to tell you about is a voluntary movement, or we can say that it is a rhythmic movement. What is the difference between rhythmic movement and voluntary movement? Voluntary movement is started and finished with our brain function and with our intention. But rhythmic movements are able to be done automatically, but we are able to make some control on them. And this movement is mastication or chewing. When we put a food inside our mouth, the first movement that we should do done is to grind this food into a smaller piece. Therefore, the healthiness of the teeth and normal function of masseter muscle is very important. Sometimes it needs very strong contraction that grind the food into a smaller piece. And in this process, as you can see, the motor branch of cranial nerve number 5 or trigeminal nerve is involved. This trigeminal nerve is under the control of the several other nuclei in the brain, particularly those nuclei that are involved in the food intake and control of food intake. Those areas that are involved in the motivation and limbic system, those systems that are involved in the pleasure centers, and as you see, hypothalamus, amygdala, even cerebral cortex is affecting this center. You may ask me, what is the role of cerebral cortex or amygdala or limbic system in this process? What is the importance of these centers? You know that chewing mechanism is particularly dependent on our insight about the food. And therefore, sometimes some factors could inhibit the contraction of the masseter muscle and do not allow chewing one food. Hypothalamus is involved because hypothalamus is involved in the cycle of food control and food intake control. Therefore, if you are completely satisfied and you are not hungry, the chewing mechanism will be inhibited. If you are in trouble or you are in a stressful situation, again, food intake will be a little interrupted. Amygdala, that is involved in our emotion and emotional response, it is involved in the swallowing and also chewing. And you know that everybody has this experiment that when you have a bad emotional state, the chewing mechanism will be I am not going to say it is stopped, but it is undermined. Cerebral cortex is also more important. Imagine, let me bring you one example. Imagine you are going to eat your dinner, and when you look at the dinner, the food content or the smell of the food or any other factor is not your favorable one, or one type of food that we are disgusting. For example, you know that there are some intercultural differences in different countries. For us, the foods that the Chinese people are eating is not very favorable. For those, for example, Chinese people, our food is not favorable. And therefore, if the food is not our type or it is not in our interest, therefore the chewing mechanism will stop or will be undermined or will stop. Or sometimes even some reactive will happen. For example, imagine you put a piece of food into your mouth and you are chewing, and suddenly, according to the taste, because the cortex analyze the taste, and according to taste, you say that the taste is disgusting, and immediately the process of chewing will stop, and even you try to reject this food. Not only you do not continue the mastication, but also you try to remove the food from your mouth. This shows that cerebral cortex, our intention, our insight about the food, the smell of the food, about our cultural background, all these factors affect the chewing mechanism and control the chewing mechanism. But under the normal situation, if these inhibitory factors are not available, we can say that chewing mechanism, as I told you, it is a reflex or is a rhythmic mechanism. When we are not thinking about the chewing, it will be done automatically. This chewing reflex has a ring, and this ring you can see this ring in this figure. As you see, the presence of the bolus of food in the mouth will cause our jaw to a little drop, and this drop in the jaw initiate a stress reflex in the muscles. This stress reflex stimulate the contraction. Therefore, the jaw will raise again and the teeth will be closed. And again, this process will repeat and repeat and repeat. And therefore, when we are not thinking about our food, this process will done automatically to the point that the sensory receptor that we have in the mouth will sense that this food is soft enough and the pieces are small enough. Therefore, we are able to swallow the food. Before it, you may swallow you may doing this cycle several times, and when it becomes completely mixed with the saliva, it becomes completely soft and semi solid, not completely solid, and it is uh, uh, completely soft in order to not make injury to the gastrointestinal system. Therefore, we start a process of the swallowing that I will talk about it. Therefore, this chewing mechanism is a skeletal muscle function, and as I told you, we are able to do some control. If I ask you to maintain the food in your mouth and continue this chewing for several times, you are able to do. But immediate, it is like respiration. That if I ask you to stop your respiration, you are able, but to a point that it will escape from your intention and your interruption. The chewing mechanism is especially important for most fruits and raw vegetables because they are large particles, and these are not completely and easily digestible before the chewing reflex. Some food that are large are composed of large pieces are not easily swallowing. Therefore, it should become a little smaller piece. And this is another important function of the chewing mechanism. Another important function of the chewing is that make the particle of food better to have better contact with the enzymes and with the saliva. Imagine if the piece of food was large, therefore the enzyme were not able to penetrate into the deep area of this bolus. But now, because of the chewing and because of the mixing that is happening through the chewing, it is completely soft, and it is completely enzymes could completely affect these foods and affect the particles. And for this reason, this is an important point. For this reason, that those who have a problem with their teeth and therefore do not do the chewing mechanism correctly and completely, they have problem with the gastrointestinal system. Particularly in aged person that the teeth have problem. Sometimes some aged person have not enough teeth, and they have gastrointestinal problems. And this figure out how much teeth are important for our life, how much teeth health is important for our overall health. And this is important, the point that you should know. Okay, now imagine that grinding of the food by chewing mechanism and all these centers that I told you about were working and finally reached a state that is swallowable. Now these food particles should be swallowed into the gastrointestinal system. It should be delivered to the GI system. Until now, it was in our mouth. Sometimes we are able to even reject it. But from this point, the food is being delivered to the gastrointestinal system. And the first step in this delivery is swallowing. Swallowing means the process that we are doing all the times with our saliva, and when we are eating food or drinking water, we do it several hundreds of times every day. Even I told you that even in normal situation, non-feeding state, we are swallowing the extra saliva that we have in our mouth. And again, the saliva, the swallowing is the first step of swallowing is under our control. Therefore, let me to tell you that swallowing could be divided into three parts or three stages. The first stage is voluntary. we decide when to do the swallowing, start the swallowing, and then we push our tongue, and then push the food backward and start this step. Then the next step is pharyngeal, that is, that it is a reflex mechanism. It is not under our control. And finally, we have the esophageal stage of the swallowing. Let me to discuss about each of them separately. Firstly, the voluntary stage. Voluntary stage, as you can see in this figure, means when we do the chewing mechanism for several times and reach a step that food is acceptable and completely soft and semi-solid or a little mush-like. Here we decide to do the swallowing. We put our tongue on our on top area of our mouth, and contraction of the tongue will generate a pressure behind the food, a piece of food, and this will be pushed into the pharyngeal area. As you know, this is the voluntary stage, and as I told you before about the swallowing, it is under the control of several areas of the brain. Again, swallowing is under the control of the visual system, of the olfactory system, about even our memories and our concept about the food, even the areas that are involved in the regulation of food intake, and all those factors that affect the chewing mechanism is able to do the swallowing mechanism. But when this step is passed, then the pharyngeal stage is a reflex mechanism, and it will be done automatically. Let me show you in this figure. In figure A, you see that we have a hard palate in the mouth, and this is the tongue. The contraction of tongue will push this food backward into the pharyngeal area. At this stage, as you see, the airways are open, and we are breathing normally before this stage. But when this stage starts and the food was pushed into the pharyngeal area, this is in one categorization, we can say it is buccal phase. The food will have a contact with pharyngeal area, and this immediately will close the soft palate to close the opening of the mouth to the nose. Therefore, the connection between nose and mouth will be closed. On the other hand, in the pharyngeal phase will start, and this is the process that the glossopharyngeal nerve and vagus nerve are involved. And as you see, immediately not only the airway to nose is closed, but also the epiglottis will close the thoracic opening, or therefore the airway is closed. At this stage, respiration will stop, and there is no way to respiration, because during the swallowing, the airways are closed. But at the same time that airways are closed, the upper sphincter of the esophagus, that it normally is completely and strongly contracted, will be relaxed. We have a closed area. Tongue is contracted, therefore there is no way for forward movement. Airways are closed, therefore food has no access to the airways or to the nose. Just one way remains, and this way is esophagus opening. And as I told you, because the upper esophagus sphincter is relaxed, therefore the food will be pushed into the esophagus. When food enters the esophagus, the pharyngeal stage will stop and will be finished, will be over. This figure is showing another time. In another figure, this is tongue and this is hard palate. This is soft palate, and tongue will be contracted and push the food backward. Now the food is in the pharyngeal area. Soft palate close the airways, and on the other hand, epiglottis close the trachea. And now the food will have the one way, just one way to enter the esophagus. And as you see in figure D, this food enter the esophagus. When food enter the esophagus, then the airway is able to open and allow our respiration to happen. This is important for us because you know that during the swallowing and the pharyngeal stage, the respiration is stopped for a while. But we should know that if we start to do some another, for example, some another interfering function. For example, during the pharyngeal stage, we try to start speaking or generating voice. Suddenly, this process will be interrupted, and sometimes the epiglottis will open incorrectly and in incorrect time, and allow some food to enter the airways. And this is the process of aspiration that you know it is happened to us several times. And sometimes the saliva itself enter our airways, but normally it is not happening. Just in the times that we interrupt this process, this aspiration will happen. And sometimes in some cases, particularly in the children's, they are eating a food and suddenly start to generate voice. Therefore, the airway open and this food enter the esophagus, enter the trachea, and this aspiration may be dangerous. But normally this is not happening. For this reason, we are also all the time we are advising people, do not speak when you are eating, or at least when you are swallowing. This figure shows the upper esophagus sphincter in a green circle. And as I told you, normally the upper esophageal sphincter is closed. But when food have a contact with the pharyngeal area, one response is the relaxation of this muscle, and therefore increase their receptivity. Therefore, food is able to enter the esophagus. When the food transfer to the esophagus, then the other part of the esophagus will do the peristaltis wave that I told you before. And this peristaltis wave move the food downward until they reach the stomach. I will talk about this again. But as I told you, the contraction of the upper sphincter, upper esophageal sphincter, and also lower esophageal sphincter do prevent the reflux of stomach content into our mouth. And you know that stomach content is completely acidic. Therefore, it may be dangerous for us. This is important that during between the meals, these sphincters should be closed and prevent the return of gastric content into the esophagus and into the mouth. But during the swallowing, they should be open and they should be relaxed to allow the food to enter this area. And now, when the food enters the esophagus, according to the peristaltis wave, we have a movement of food downward. Particularly in this process, the gravity is also important. You know that during the digestion, when we are sitting on our chair, the gravity will help the movement of the food downward. And for this reason, we do not advise anybody to eat or drink during the supine position when they are lying down, because the gravity is not helping out. This figure is showing the pharyngeal area and swallowing center that receive the sensory information from pharyngeal area. And these are nucleus such as non-vagal nuclei, nucleus ambiguous, dorsal motor nucleus. These will receive the information and then send back the signals to start the contractions that I told you, and therefore push the food into the esophagus. Now the food is in the esophagus, as I told you. And I told you that upper esophageal sphincter is a striated muscle, and it's under the control of this regulatory reflex mechanism. It means that pharyngeal stage start the relaxation of upper esophageal sphincter. When food enters the esophagus, now the smooth muscle will start to contraction. And for you see that here we have a smooth muscle, and the peristaltis of a smooth muscle will push the food step by step forward. This figure shows the pressure inside the esophagus over time, and you see over time it is moving forward to reach the stomach. If I want to summarize this process of pharyngeal stage and entering food into the esophagus and starting of the esophageal stage, I can say that the timing is less than or about 1 second. The first point that we start the swallowing by function of tongue, that tongue thrusts up and back, and nasopharynx are closed, is happening in the first milliseconds. Then larynx will be elevated, airway will close, upper esophageal sphincter will open, and pharynx then will contract. And this generates the force to push the food into the esophagus. All this time is about 1.1 second. During this 1.1 second, respiration is stopped. And for you know that this is not dangerous for our respiration, because we are able to hold our breath for several seconds. And this 1 second is not very lengthy for us. Finally, food will reach the lower esophageal sphincter. This is the lower esophageal sphincter. You can see here in this figure also. Again, I told you that lower esophageal sphincter is closed all the time and prevent the return of the gastric content. But when food reach the behind the lower esophageal sphincter, again, lower esophageal sphincter will be relaxed and allow the food to pass through this sphincter. And this figure is clearly show that normally it has a basal tone or contractile state. But when food reaches because of the swallowing, when swallowing starts, over time, this will be relaxed and remain relaxed until the time that food completely pass through the lower esophageal sphincter. And as you see, after this passage, again, it will be contracted and increase its tone. It shows that it will open just during this swallowing state. And you know that there is a very common clinical case that this sphincter is not normally functioning or completely functioning. And we have a clinical state named as gastroesophageal reflux or GERD. In the reflux, because of the incomplete contraction that we have in the lower esophageal sphincter, some of the gastric content is able to move back into the lower areas of esophagus and make some injuries and problem with the lower esophagus. And in more severe situation, this content even can reach the mouth, and your patient is complaining about the pain and also the bitter taste that they have in their mouth because of the returning of this acid into the mouth. And you know that this acid will injure and make injury to the mucus of the esophagus, and in severe situation even cause problem in the to the everyday life. This is named as heartburn or indigestion that that some patients have, and there are several ways. One way is to reduce the acid content of the stomach. There are some other maneuvers to protect the esophagus from this acidic content. On the other hand, sometimes this lower esophageal sphincter do not relax at the time that it should. Therefore, because of this contractile site that remain, some of the food content that want to pass through the esophagus is not able, and therefore remain in the esophagus. This will dilate the esophagus and even cause some injuries to the esophagus. This is named as achalasia. Achalasia is incomplete relaxation of lower esophageal sphincter. Sometimes it is opened by inflating a balloon inside this sphincter or other maneuvers. Therefore, lower esophageal sphincter and its normal function is important for us in two directions, and it should be mentioned here. By this slide, we reviewed the motor function of mouth, pharyngeal area, and esophageal area. Then we want to start the motor function of the stomach. From now, the stomach is the place that is storing the food and is responsible for some very important motor functions that are important for the correct and proper digestion and absorption. Because the timing of this file is a little lengthy, it reached about 37 minutes, so 38 minutes, and we have a limit in our length of the file. I will stop this part here and we'll continue the motor function of the stomach in next file.